This is Dr. Schoor again. I'm going to talk a little bit today about sperm retrievals. Last time I spoke about the management of the azoospermic male. Now I'm going to talk about a little bit of how we actually do a sperm retrieval. Once we decide that we're going to proceed with that treatment for the man's azoospermia, um, how exactly do we go about doing that? Well, in general, what I like to do is coordinate the procedure with the patient's wife's egg retrieval. This is not necessary in certain cases, but I like to do it for a variety of reasons. Uh, uh, Once we have the date or date range that the wife's eggs will be retrieved, then we clear our schedule for that morning. 2, 3, 4 days in a row, the schedule's cleared, and we are kind of on a holding pattern. And we're called when the wife actually ovulates, and they can go in there and retrieve the eggs. Uh, so then what I basically do is I show up in the morning after having had discussed the procedure with the patient numerous times and its risks and so on, and I meet the patient in the IVF facility, and we discuss it one last time. What I actually do during the procedure is once the patient is anesthetized or sedated, I numb the area doing what's called a cord block. I numb the skin, uh, and then I determine, based on the cause of the man's azoospermia, whether or not I'm going to do an epidiymal sperm aspiration or a testicular sperm extraction. Uh, an epidiymal sperm aspiration is appropriate in men that have obstruction as the cause of their azoospermia. However, in men that are not producing sperm as the cause, an epidiymal sperm aspiration is not appropriate because you're not going to find any sperm. The next determination is whether or not I'm going to do the epididymal sperm aspiration as a percutaneous approach or as an open technique. Percutaneous approach is useful for uh, men that have had vasectomies many years ago, and they have a big dilated epididymis, which is a big target, and I can stick a needle in it, often under ultrasound guidance, and pull out tons of motile sperm that can be used. Um, uh, Often, though, the epididymis is not that dilated, and it's not a big target, and in this particular case, I would convert to an open technique. So what I do is I make a small opening in the skin overlying the testicle in the scrotum, and then I deepen it through the various layers of the scrotum until I can expose the uh, testicle and the epididymis within the scrotum. Uh, uh, then I basically make a small opening in the lining of the epididymis and enter an epididymal tubule, and often milky fluid will come out that will contain millions of sperm. These I can put into either glass capillary tubes or just take a syringe and aspirate them up and give those to the embryologist. If there's sperm and it's motile and the embryologist says it looks good and healthy, often this is all that's needed to be done. If the embryologist does not find sperm or does not have enough, then typically we would go to a testicular sperm extraction. The advantages of a testicular sperm extraction are that the sperm is healthy and often healthier than epididymal sperm because it was just born and it has not had time to be degraded and be old and hanging around the epididymis for years and years and years, which happens in sperm that are found post vasectomy in the epididymis. So testicular sperm is actually very healthy. And it's very easy to get at. I make a small opening in the lining of the testicle, and then some yellowish tubules will come out through the opening. These are what are called seminiferous tubules. I can pull on some of these tubules. In the cases of obstruction, hundreds of sperm will be within each of the tubules. I hand some tubules to the embryologist, and they can mince them up and take out the sperm and use 5 or 10 of them for a fresh ICSI procedure right then and there, and the remainder they can freeze. In cases of non-obstruction or production disorders, often you don't find any sperm when you do your initial opening in the testicle, or if you do find sperm, you only find one or two. This is why it's really so important to coordinate your procedure with fresh egg retrieval, because if you only find one or two sperm, you don't want to freeze them. You don't want to risk losing these sperm or having them die in the freeze or thaw process. So I personally opt to use these sperm uh, fresh in conjunction with the egg retrieval, so that gives the patients the best possibility of having a successful and happy outcome, which is a pregnancy and a baby. Um, Once in a while, the man's production disorder is so severe that the best approach is to do what's called a micro TESE, or a testicular microdissection. Um, in this procedure, we bring in an operating microscope and we open up the length of the testicle, and we look through the epidiymal tubule, or the testicular seminiferous tubules, under high power microscopy. We can often see tubules which are more normal in shape, fuller, and these we can remove rather in a more targeted approach and have increased success of finding sperm. And that sperm is often healthy and can be used for in vitro. You can increase your success rate by about 10 or 20% using a micro dissection, testicular sperm extraction. One of the issues is that not all the IVF facilities are equipped with operating microscopes, and it's very difficult for the embryologist to work with the tissue. And often, when tissue, while you do sometimes find sperm, the sperm is not really capable of fertilizing the egg anyway. Um, but it is something that can be done and is offered, and something if you came into my office we would discuss as a possibility. Uh, and Testicular sperm extractions are safe for the testicle. Uh, Testicle will show some scar of having had this done in the past, but other than that, if it's done correctly, the testicle is no worse for the wearer from having this procedure done. Uh, the testicle, though it does not have sperm, will still continue to produce testosterone, and uh, uh, the man will otherwise be completely healthy, even if he does not have any sperm in the ejaculate. Uh, and that's basically it. If you do have any other questions in the future, please feel free to contact me. Thanks a lot.